Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Sanjeev Kaul. Thank you so much for being here today, Doctor.
Thank you so much for having me.
You are welcome. Okay, Doctor, you specialize in urology. First, tell us what that is. What is urology?
Urology is a medical specialty that treats diseases of the urinary system and the reproductive system. So we are talking about diseases with the kidneys, the ureters, the urinary bladder, prostate in men, and also the uterus and the reproductive system in both men and women. Common conditions that we would treat would be kidney stones, bladder stones, prostate problems in men, and in women, incontinence, and again, kidney stones in women as well. My area of specialty is cancers, and I've had training in that, and I've been treating cancers for the last 20 years. So that would include kidney cancers in both men and women, bladder cancers in both men and women, and then prostate cancer in men.
Okay, doctor, so what are some of the common symptoms that would indicate, hey, I need to go see a urologist?
Back pain, which is commonly seen in stones, leakage of urine, which can be in both men and women, difficulty urinating, which could mean a prostate problem in men, bleeding in the urine, which could mean cancers both in men and women. And for some of the cancers, you want to pick them up when they are early and they really don't have any symptoms, which is why we recommend yearly screening, so we can pick these conditions up early.
Sure. And now specifically for men, what signs should they look out for prostate cancer?
For prostate cancer in men, if we want to pick it up early enough, there really are no signs and symptoms. We want to pick up the cancer before you have any symptoms. And we can do that with a yearly screening with a blood test called a PSA, occasional MRIs of the prostate for people who have family history, and also a finger check of the prostate.
So how and when should someone schedule an appointment, doctor?
It's recommended that men see a urologist as soon as they turn 40. And if you have a family history of prostate cancer or breast cancer in your family, you want to come and see the urologist even earlier. You want to set up an appointment once a year so we can see you and do the appropriate physical exam and blood and imaging tests.
And what do you want people to know about your specialty, doctor?
I think it's a very important specialty. Prostate cancer is the commonest cancer in men in the United States. And with the increase in the number of elderly patients, both men and women, there has been a huge increase in the need for urology. It's not a common specialty. People, I think, don't keep it in their mind. But incontinence in women, especially older women, urinary tract infections in older women, and prostate problems from a benign enlargement of the prostate, and also cancer in men.
Now, is there anything that you'd like to add? I know one thing you did say, you stressed prevention is key. Anything else?
There have been a huge number of changes in how we treat prostate cancer in men. In the past, each and every person who was diagnosed with cancer was treated either with surgery or radiation. But in the last 10 years, we've found that you can elect not to treat almost 50% of those people. Because what we've realized is some types of prostate cancer are slow growing and they're not going to cause you a problem. And we can just elect to observe you and not treat you. And the big advantage of that is the side effects of treatment in men is pretty substantial. A lot of people will have incontinence and leakage of urine. They need to wear a diaper, and a very, very high proportion of people will be impotent. This is something that people are not generally aware of, and there's a lot of fear factor when you're diagnosed with cancer. And I think it's very important for us to bring that out to the community and tell them not to be afraid. And a large number of prostate cancers can just be managed with just observation and monitoring, and you don't need to be treated, and you can avoid these side effects.
Well, thank you very much for calling in and providing us this very valuable information today, Doctor.
Thank you so much for having me.
You're welcome, Doctor. Now, if you'd like any additional information on today's topic, just head on over to the Hot Links page on WNEM.com.